Welcome, hello.
Hi, thank you for having me.
Oh, thank you so much for being here. So for those listening in, Dr. Rachel is a neuroscientist, psychologist and researcher who specialises in wellbeing and trauma recovery in those with chronic or neurological conditions. Her research and development of wellbeing strategies has come from all of her personal experience and working with those most affected. She's passionate about developing programmes focused on creating the best life, no matter what stage an individual is at. So welcome, Rachel. I guess a really good starting place is, would you be able to tell us a little bit more about how you became interested in supporting people with chronic or neurological conditions?
Yeah, I think first of all, there's a bit of a lack of information and a lack of support out there for people with any type of neurological and chronic conditions, and there's a sort of an acceptance that you're not going to get the kind of support that you need. And I had a couple of conditions and experiences in life that sort of made me more curious about, how the brain and the body work together. I had a background in working with the most marginalised, disenfranchised people, and I sort of just brought everything together to start sort of discovering how life could be better, what things work together, what things mattered the most, and what was most effective in actually supporting people to move forward, to go beyond a sort of a chronic condition, however that was caused, and actually to start embracing the life that they chose to live, really. And like I say, it was from both a personal and a professional point of view. There was nothing out there that was really helpful for me to recover completely, so I had to do sort of research and create hybrid treatments for myself, and research and interest sort of snowballed on from there. And I'm just in the position now where actually I like to think as somebody who works with the people, I'm quite authentic in how I work, because I actually do understand quite a lot of the barriers. I understand what it's like to wake up with no energy. I know what it's like to wake up and feel despondent, not to get the answers that you want from other professionals, and basically have to start living your life from scratch again. So yeah, I feel quite privileged that I've had that experience, and I can actually apply it both with my professional knowledge and my research abilities to make things better for other people.
So effectively a learned and lived experience.
Yeah, sadly.
Yeah.
It's definitely good at the same time, yeah.
And I guess that leads me on, are you saying then that you believe that chronic conditions can be cured by talking therapies alone?
No, I'm not saying that at all. I'm saying that therapy in itself, talking therapy in itself is really useful in many ways. But obviously with a chronic condition, we're not just our psychology. There's a whole host of physical symptoms, physical ailments, and we have to have sort of a 360 well-being, wellness, recovery approach. It's not just about the medical model, it's not just about the psychological model, it's not just about let's just wait and see model. It's about actually combining everything to give that person the best chance that they've got to recover and to sort of discover who they are, in the future, and move towards that good life.
So I guess that from the more like psychological perspective, how important is it to get answers and a definitive diagnosis, even if there isn't a cure as such? What would you say to doctors that say, there's no point in testing to confirm a root cause is irrelevant, or the treatment will be sane, or there's no treatment, whatever? That was a question that came in from one of our members.
Yeah, I think it's really important for an individual to understand what's going on in their body and the mind, because you have so much control taken away from you. Sometimes it's really comforting just to try and find what the root cause is, to try and find what's causing anything. I'm a bit reticent about saying that that's the be all and end all. I know it's quite useful. I know it's useful in many ways. However, a person is not a condition. And I think it's important to try and retain some sort of flexibility around, you know, what exactly is it that's going to make your life better? What do we need to look at, to concentrate on, to help you have a better quality of life? You know, what is bothering you the most in your symptoms? Because I know for me is that when I've been really poor, the thing that affects me the most is like the constant fatigue, the tiredness. For other people, it can be that it's like sort of the pain in the limbs, it's, you know, pain in the body, whatever, you know, that symptom. So everybody's different in how they feel their condition differently. And I think, so there's a need to balance that with the, you know, the need to actually have that definitive piece of paper saying, yeah, you know, you have such and such a condition. I think it's just people need to realise that they are an individual and it will affect them differently to how it will affect other people. And, you know, equally, you know, medical and healthcare professionals need to remember this as well, that it's not a one-size-fits-all approach.
Thank you. I guess leading on from that, a different question that came in is, regardless of whether you've got a diagnosis or not, how can you start to accept what's happened to you, especially when learning to live with the uncertainty of having an unpredictable malfunctioning body, and equally coping with what people think around you, because, you know, sometimes people think that it's in your head because you physically look fine.
Yeah, I mean, that is $1 million question for quite a lot of people, and for me, it's often the sort of psychological and neurological symptoms that are actually the hardest to manage, because physically you look fine, but mentally you feel terrible. And what I would actually say there is that the reason why quite a lot of people find it difficult is because they've not actually accepted in themselves that their life is never going to be how it was pre-condition. You are never going to be that person. You can't be the person that you were yesterday, let alone the person that you were sort of weeks, months, years before you actually got whatever condition is afflicting you now. So I think there's a need to accept, and there's also a need to realise that there's a grief and a loss process that needs to be gone through. That is an essential part in the acceptance, that people are allowed to realise, you know, that they've had a really tough time, you know, they're having a tough time, and that it's essential to sort of acknowledge that, and that it's not, you know, it's nothing bad, it's not weak, it's not, you know, it's not showing you as a bad person, it's actually showing you as very human, and that life sometimes throws at us experiences, situations, conditions, illnesses, diseases, people, anything really into our life, and we may not want to have had that experience, and we may not want to be going through that experience, but yet here we are. And I think it's very important that people, you know, acknowledge that. And, you know, also I think it's important that if you are around somebody who is, you know, not willing to sort of respect or acknowledge your position, that you can't change that person. The only thing that you can change is your response to it or your reaction to it, and, you know, your choice of whether to be around that person or not, or how much you allow that person to affect your mood or well-being. And these are very real choices, is that sometimes when, you know, we're really poorly and we are really, you know, at the lowest, you know, sort of ebb of our control, is that there are certain things that we can still control, and that can be really helpful in sort of going forward and remaining separate from our condition.
That certainly resonates with me, because even as a healthy person, if they looked back a year ago, they couldn't go back to be that person that they were. But as somebody that's gone through quite a life-changing illness, or a very life-changing illness, it's an even more dramatic change. And I can see what you're saying then about needing to grieve that. That was certainly the case for me, and to accept that loss and grieve it before working out what life might look like moving forward.
Yeah, absolutely. And this is something that I think is inherent and should be part of everybody's sort of recovery process is sort of, it's all intertwined with the identity. You know, what parts of you are you mourning? What parts of you are you grieving? What parts of you do you want to retain and work on in the future? And what parts of you have you yet to discover, you know, and bring into awareness? And I think that is a real sort of positive to you know, to take from having a chronic condition. And I know that people probably might be listening to this and thinking, I can think of nothing positive. I can think that, you know, it's just been hell on earth, really. I can just tell you, I felt so ill. I've had no help. I've not got the right treatment. I'm not being believed. All of these things, you know, it's very traumatic. But I think at the very, you know, sort of basis of it, the very base of foundation from which it can come from is actually, you know, how much of my identity is caught up in this, and how do I want to use this situation to create a better life for me going forward.
What practical things then can people do during that process and to manage that? What you know, from a practical point of view, what can people do to manage through their mental state and the expectations of themselves?
I think from a very practical thing, I think the first and foremost, what people need to do is be kind to themselves. And I know I can say this with a certain amount of irony in that when I was really poorly, I can remember feeling too tired to do anything to take my children out for the day. And, you know, I was just on my own with my two youngest children. And I felt so guilty about that I actually made 3 cakes. I think I made a 2-course lunch and then wondered why in the afternoon that I completely collapsed and couldn't go on, you know, further. And I had to sort of play around my bed. And, you know, if I'd have been kind to myself, you know, I thought I was being kind by sort of saying, oh, I can't take them anywhere. But I wasn't. I ended up doing more work because I felt so guilty. I felt ashamed that I couldn't be the mother that I wanted to be. And so I think in a practical sense of it, it's actually like, what can you feasibly manage, and knowing that that's okay, you know, knowing that you are doing your best, you know, no matter what your benchmark before used to be, you are actually doing your best, and that should be good enough. So in terms of when we talk about practical things, it's like, oh, right, well, you know, take away supplements, make sure you eat 3 times a day. I think it's more sort of a mental and emotional nurturing that people need. And when I say be kind, it's like literally, what is your limit? Do less than that. You know, on a daily basis, gauge what's the most I can do today, do half of that. But because you are in recovery, or you're still really poorly, or you are at the very end of the hardest journey that you've been on in your life. So when I say be kind, I don't say that lightly.
No, that makes a lot of sense. And I guess by doing less, you're saving that energy to allow your body to recover, to allow your body to heal, aren't you? So I can see how that's so important. Yeah. And for somebody that's, you know, perhaps accepted what's happened to them and gone through that grief and being kind to themselves and looking outside of their condition and their illness, how do they go about discovering who they want to be in the future, or what they want their future to look like?
Well, I think a good place to start is by looking at what brings you joy, what makes you feel content, what makes you feel alive, what gives you passion, and, you know, what is important to you in your life. You know, what are the important things? Is it important to you to have time with your family? Is it important to you to develop yourself mentally? Is it important to you to spend time in the garden? Is it important to you to create? By starting to look at what we enjoy and what makes us feel fulfilled, it's a really sort of gentle, tentative pathway into actually thinking about who do I want to be in the future. You know, if you get the most fulfillment from growing tomatoes, making chutney, and being there for friends, it's highly unlikely that you're going to be happy in a Monday to Friday 9 till 5 with a 2-hour commute to and from a big organisation. And sometimes we have to, you know, sort of start asking ourselves the questions about what is important in our lives based on what is going to make us feel more human, what is going to make us feel more content, and what actually is going to nurture our minds and our bodies. And it's going to be different for everybody. It's going to be a different outcome for everybody, but it's the same process that people need to go through.
Brilliant. And what about carers? What can they do to support somebody?
I think carers first and foremost need to care for themselves. You know, I always, you know, think of the analogy of, you know, when an airplane's going down and there's oxygen masks and they say, you know, put them on yourselves first before you put them on a child. So the carers need to look after themselves first and foremost. And also the carers need not to take responsibility for somebody getting better. The carers just need to be there to support that person. And not put any parameters on themselves or actually on the person that they're caring for. And I think actually to realise that caring for somebody in itself takes quite a heavy toll on the body and on the mind if you are looking after somebody who's quite poorly for quite a substantial amount of time. And again, there can become identity issues where that person only identifies as themselves as a carer and they sort of lose identity with themselves as a real person. So they need to go through a similar process as somebody who has been poorly with a chronic condition.
Okay, that makes sense. Some of these questions that have come in, then it's jumping back a bit really, but I didn't want to interrupt your flow a little while back. And you talked about not being believed, and that's definitely a common experience for our members. And one member asked that the experience of being disbelieved and let down by so many medical professionals has left me feeling traumatised and afraid of needing to consult with medics for any health problems for me or my close family members. How can I heal from this?
Well, I think there needs to be an acknowledgement that, particularly in our health system, that you are unlikely to meet any health professional that knows about all of your body or all of your mind, because the way our NHS is, there's quite specialist departments. So at any one time you could have one condition but be under multiple consultants and they're not going to have all the answers. A way to get past sort of the trauma of not being believed is just to, I suppose it's almost like, to recognise that not everybody has expertise in every area, and that also you need to acknowledge that you are the expert on your body and your mind and your brain. You are the person who is having this lived experience, and you are the person who is feeling all what you are feeling. And I think there's a need to sort of take responsibility and think, if you're not getting the answers that you want through the traditional routes, that there may need to be a responsibility to explore other avenues to get help with that matter. And I know it's quite disappointing that we can't get what we want all the time through the traditional medical routes. However, I think sometimes by taking control ourselves and taking responsibility for our health and everything surrounding our health, our whole well-being, can be very cathartic in releasing some of that trauma. And I think, you know, that, like I say, not everybody is infallible, even doctors, you know, and you will get, you know, people in medical communities who don't agree with other doctors in the medical communities. You know, we have opinions on opinions on opinions. You know, for every piece of research, there's a piece of research that disproves it. So it's about actually being proactive and deciding what would work for you, what you respond better to, what feels kinder to you, what feels more realistic and true to you, you know, and in doing that, we can sort of start feeling our way through the mire and actually realizing, you know, what is going to make us better and also what is going to be quite toxic to us. And I think as well that there needs to be some sort of, I don't know, it's almost like having a reality check, in that we can't expect just one person to be responsible for getting us well. It's like you need to have a whole host of people that can get you well, but the person who is most responsible for getting you well is you know, you, and because only you can decide what is the best way forward, what resonates better with you, what feels better for you, and you know, what is actually, you know, going to be the best match for you in order for you to get better.
I think it leads quite nicely onto another question from a different member, and whether the trauma is from the experience of it, you know, going through that process of not being believed, or from something completely unrelated to a condition and an experience in your life that you've had prior to being unwell. The question was, how can somebody release the held trauma without expensive private therapy, or at least how can they work through in the most productive way, not being entirely alone, and working out how they can shift those patterns into the best, and their body into the best state to heal?
Yeah, I think there's quite a lot of there's quite a lot of cheaper cheaper ways to get therapy other than sort of a one-to-one. There's quite a lot of resources out there, particularly around trauma. The PTSD Society has quite a lot on there, and you might be lucky enough that there'd be sort of they have self-help groups who meet up. There's quite a lot of books on trauma. For me, you know, one of the simplest ways of acknowledging is just to acknowledge that you have it in your body. And you know, a really simple exercise could be when you find yourself triggered by something that has made you anxious, something that has given you a flashback, is just to, you know, acknowledge that your body is having a physiological reaction because you have suffered so much trauma, which isn't nice. And I can say that, you know, for somebody who has had a diagnosis of complex post-traumatic stress disorder, you know, I can say that wholeheartedly, that I have got that lived experience. And often what I have to do is allow that feeling to arise, know that it's there for a reason, know that it actually is telling me that I have not been living my best life, I have not been living my good life, and that I have been doing too much of one thing and not enough of another. So using it as information. And then other things that I have to do is ground myself. I do visualization, meditation. I activate my parasympathetic nervous system, and that's by doing things that I really don't want to do at that moment in time, like force myself to watch something to make me laugh or put music on. Even things like giving or asking for a hug, giving somebody else a hug, holding hands, just being able to be close to another person can really help you through that trauma. But you know, there is quite a lot of educational stuff out there. There's quite a lot of online support programs which will talk you through a process to help you cope better with trauma. But I think, you know, let's just be really honest here, is that trauma needs to be processed. There's not going to be a magic pill that just takes it away. You know, I speak about this all the time. If there was a magic pill, I would be taking it myself, because who doesn't want it to be easy? Processing trauma is probably one of the hardest things that an individual will have to do in their lifetime, because the body never lies. It stores trauma, it stores emotion in muscles, in joints. Our brain is not helpful. We can have memories that are stored that we don't even know that are in there, that can come back at any one time. And I think it's just an acknowledgement that to process trauma, whether it's through the trauma of being really poorly, or the trauma of not being believed, or the trauma of not being treated well, anything that could trigger that trauma response in the body needs to have sort of, you know, a difficult process to get rid of it as well.
Mm-hmm. Mm-hmm. Thank you. I'm sure that will be helpful to many. A different question about a slightly different topic was, at my worst, I was jumping out of my skin with anxiety, hypersensitive to light, sound, smell and touch. What's actually happening in my body and brain to cause this, and what can I do to manage the symptoms?
Yeah, so basically what's happening there is that the nervous system is split into two, really. It has well, it has more than two functions, but the two functions that we're going to talk about here is the sympathetic nervous system, which is basically our fight, flight or freeze part of our nervous system. It's the stuff that keeps us safe, it's the stuff that reacts to danger, it's the stuff that responds to trauma and stress. The other half of the nervous system is a parasympathetic nervous system. And that part of the nervous system is the one that keeps us in homeostasis, keeps the balance in the body, it helps us digest our food, it helps us regulate temperature, it helps everything just bumble along quite nicely. And so when you're having sort of an anxiety response, an anxiety attack, a stress response, a fear attack, however you want to call it, it's basically because your sympathetic nervous system is running the show. Now, when that happens, you really have to try and sort of switch back on the parasympathetic nervous system. And that's why you should really have a sort of a joyful toolbox. It's things that are actually going to stimulate that part of your nervous system. So like I said in the question before, it's something that I have to have, you know, because I have trauma, so I can sometimes be stuck in the sympathetic. So in my joyful toolbox, I have music that makes me feel happy, that I can dance to, because dancing is really good for, you know, getting the trauma outside of the muscle. Singing is really good because that stimulates the vagal nerve, which actually can help to stabilize and sort of maintain and develop the parasympathetic nervous system. Hugs, human touch, hugging a pet, even hugging a soft toy can stimulate our oxytocin receptors to start producing more oxytocin, which will make us feel more cared for, more nurtured. Chamomile tea, valerian tea, anything sort of herbal along those lines, verbena, can actually calm our nervous systems down and actually help us to move into a more relaxed state. Meditation and visualization are in my toolbox, but that's because I practice quite a lot. It might be a little bit too much for somebody to initially go, because the mind might be racing, there might be too many thoughts. So in that case, it might be useful to do a body scan. To start at the toes, and you tense and relax every single muscle in your body until you get to the top of your head. And by doing that, we're actually just, you know, distracting ourselves, but actually doing something active within our body to try and relax all of our muscles, which will all be on high alert. And when you are doing that, it might be useful just to ask if any part of your body has any information for you, because in doing that, we can certainly get more information than we had before. Colouring in is really good. You know, my daughter had high anxiety over something she had no control over, and I actually got a colouring in book and some pencils, and that really helped to get her anxiety levels down, because you sort of activate the right hand side of the brain, which is really useful in dealing with sort of that stress response that we get from our sympathetic nervous system. But I can just say to people that they will know what they enjoy doing. Joy is such a useful emotion to have. You know, it activates our parasympathetic nervous system, and it feels so counterintuitive when we're in that fear state. You know, but joy is actually the antidote of fear. So whatever gives you joy, even if you don't feel like doing it, you really need to, you know, just try and do it for 5 minutes and see if it makes a difference.
Thank you. And if then we can move to sort of your more neurological side of things, rather than, well, I know you can't separate them completely, but rather than just mental well-being. Could you explain what happens to the brain when it's been under attack? So if somebody's got Lyme and potentially co-infections associated that have attacked the brain, and that some of the co-infections can have quite psychiatric symptoms as well. So what's actually happening to the brain when it's under attack?
Well, its function and its structure are going to be compromised. You know, the brain is made up of so many different sort of biochemical connections that having, you know, something foreign in there is going to disrupt those natural sort of alliances and creations of things, really. So if you've got sort of a pathogen that's attacking a certain part of the brain, it's going to be affecting the neurons. So the neurons are not going to be able to communicate properly. They're not going to be able to make the connections, the electrical impulses like they used to be able to do. I mean, and in certain extreme cases, you know, that part of the brain could end up with quite severe damage. The good thing about the brain is that the brain is very plastic, in that, you know, research has shown that even, you know, getting into well old age, you know, the brain can create new neural pathways, it can create new neurons, it can, you know, still learn new things, it can still remember things. You know, it's about how we use the brain. I think the one thing that people need to consider when, you know, they have sort of sustained any kind of brain damage, whether it's from a bang to the head or a stroke or a pathogen, you know, anything which has disrupted that normal brain function and the structure of it, is that the brain is really plastic, but you are going to just have to be a little bit patient and again, kind of with yourselves, because that part of the brain is going to need to repair and recover. And would we expect sort of, you know, a 12-month-old baby who was learning to walk to be able to just get up and run a marathon within a day? We wouldn't. And yet we expect our brain to do something similar just because we're adults. So I think there needs to be a real understanding that, you know, it takes 8 weeks just to create a new neural pathway. That's it. Just 8 weeks. It takes 8 weeks. That's 56 days. It takes to create a new neural pathway. It takes far longer to solidify that pathway, to make that pathway actually remember what it's meant to be doing, to be able to work effectively, you know, and it's a long process. It's not going to, it's like Rome wasn't built in a day. Brains can't recover in a day. You know, also people need to, you know, do brain friendly things. You know, are they using their brain in the best way for them? Are they having a really good sleep at night? Are they allowing their brain to detox? Are they, you know, generally people who have sustained some sort of damage to the brain are going to be more susceptible to sort of electromagnetic frequencies. You know, have they got a good bedtime routine? Are they switching the router off? Is there as little pollution around them as possible to help their brain to do that detox so it wakes up fresh and ready for the day? Or are people thinking that they should be doing all of that anyway and, you know, punishing their brain by thinking we need to do X, Y, and Z, you know, more than somebody who has not sustained any kind of brain damage? And I think, you know, it comes back to that, you know, the need to nurture and the need to recognise that people can and do recover, but it's people who have a more positive mindset, a more kind approach to themselves, and who actually, you know, do show that understanding of what they need rather than what they think they should be doing, that actually, you know, thrive after, you know, sustaining quite severe brain damage.
I think that's an interesting distinction. You said around a positive mindset and being kind to yourself. I sometimes think a positive mindset can mean pushing through, trying harder, doing more to recover, versus resting can feel like giving up. So when we're talking about the brain and developing these new neural pathways, where's the balance between that? You know, should we be, you know, we're trying to, say for someone that's trying to learn to walk again, it's got a different example, but, you know, somebody who has had some sort of trauma and they've lost the ability to walk and they're having to learn again. To create that new neural pathway is the answer to repeat versus rest. Where's the balance there?
Well, what's wrong with do it, repeat, rest, and then repeat. What, you know, why can there not be some sort of balance? And I think that's what people need to, and it's, again, it's about being honest and truthful with yourself. People know where their limits lie, and they are the experts on themselves. And if they're not really good at managing their limits, then, you know, this is where the people around them come in and can actually recognise, because people can show signs of fatigue even if they're not aware of it themselves. But they're like, there has to be that sort of happy medium of, you know, have I done more than I did a month ago? And recognising that, because it's not a linear sort of progression when somebody's been ill. So it's no good comparing yourself with yesterday, because yesterday you might not have eaten enough, you might not have slept enough to make today better. However, if you compared yourself to, say 4 to 6 weeks ago, there should be a definite improvement in your ability to do things, or, you know, your ability to have more stamina, you know, if you are on the road to recovery. You know, obviously if you're still within the illness and have still yet to find, you know, your recovery pathway, then there can be no comparison. But if you are in recovery, you should really be comparing yourself to sort of 4 to 6 weeks previously, not the day before, and showing some progression, a steady progression, not like sort of a mild jump. We're talking baby steps here, because if you do baby steps in 12 months time, you will show a massive improvement. But you'll not be able to do that 12 months of improvement in a month.
Mm-hmm. And so it's, you know, it's about being very careful to recognise your limits and not push beyond them, and to take that rest, and perhaps not do other things that aren't associated with your recovery in order for you to allow you to have that rest and to focus.
Exactly. And also, you know, are you feeding your brain the right things? You know, have you got enough hydration? Have you had enough fats? Have you had enough protein? You know, is your brain got the best energy on hand to sort of transform into that recovery? You know, are you putting in the right foods for you? You know, and I think this is so important, the nutrition element of it. You know, I think people need to examine what they're putting in. It's very easy to grab the fast food carbohydrate and it'll give us that instant hit, but is it really feeding our brain repair? Is it feeding our body repair? Have we got the right kind of energy that we can convert into the best kind of cells? You know, have we took in adequate water? You know, whatever you think you should be drinking, you need to drink double that. and that's really boring to do. I know it is. And, you know, you're talking to somebody who has researched well-being, talked to many people, worked with many people around the sort of well-being agenda, who sometimes gets bored with looking after herself. You know, so I'm not being I'm not being the angel who's saying, yeah, you know, behave like I do. I'm accepting, you know, there's some days I get so bored with having to do what I need to do to keep myself feeling good. But you know what, if I don't 3 or 4 days, I know after that, I know I'm going to feel rubbish. And that's the price I have to pay for rebelling sometimes and thinking, no, I'm sick of keeping well. You know, and I suppose everybody goes through that, you know.
Yeah, certainly everybody that's been unwell anyway. I think that's a common one. You talked about, you know, seeing this improvement if you're on the road to recovery, but how, with something like Lyme, how can somebody tell whether it's an active infection, an ongoing infection, or whether it is lingering symptoms when the brain takes so long to change and recover?
Well, I think, you know, again, it goes back to, you know, what I said right at the beginning is, you know, you choose your medical professionals wisely, and you do whatever tests that you trust that are going to tell you about what's going on in your body, because I'm not a medical doctor. You know, I know a lot about the brain, I know about how the brain affects the body, and I know about how the body affects the brain, you know, but I'm not a medical doctor, and so I wouldn't want people to take my advice as gospel, as in, you know, this is definitively what you have if you have Lyme. So I think if you have a trusted practitioner who can run those tests and tell you that, but equally, you know, we can have echoes, we can have memories of conditions, you know, if it lasts for longer than, you know, a few days, you know, we have like some really bad days after we've had quite a number of days of recovery, then I think it's time to start asking some questions. But sometimes we can have 2 or 3 bad days is because we've been feeling so well that we've pushed ourselves beyond the limit, and then we're just, you know, having to pay the price for it. So I think that people have to have more awareness of themselves and actually think, is this right for me? And then, you know, go back to their trusted healthcare professional, whoever that may be, if they feel the need to, you know, redo some tests to see if there, you know, has been a reactivation or a reinfection, or if it's something else that's coming to the forefront, sort of virus or bacteria wise, then they need to do that. But I think there's also a need to sort of recognise that when we have started to feel better, we tend to try and rush that recovery and overface ourselves. So then we can end up feeling bad because we've been feeling better. So we forget how bad we've been. So even if we feel slightly less bad after feeling so good, it can feel that we felt worse than before. I hope that makes sense. It sounds a bit confusing to me when I was saying it. So I'm going to try and say it a little bit better before I can articulate it. So you felt terrible for the whole, you know, while you were investigating what condition it was, you started taking treatment, you started to feel a lot better, and then because you've been feeling better, you've been doing too much, you've pushed your body, you've pushed your brain, so you have a little bit of a crash. But because you've been feeling better, that crash can feel worse than your original illness did do, because you have been feeling better, because you've gone up a little bit. So then when you go down, it can feel like you've gone down more than you have done, because you've actually been elevated a little bit. So you need to be careful that you don't fall into that trap as well. And also, our brain likes to, you know, we can get a bit woe is me as well, and a bit of self-pity. It's like, I'm never going to get better. And we actually have to start looking and thinking and actually observing, you know, the changes that are being made. You know, something that could be useful for people to do is just to start keeping a bit of a mood diary or an energy diary, you know, literally just 3 things: how you feel when you wake up, how you feel when you go to sleep. And by doing stuff like that, you can actually track, you know, what kind of movement is being made, because we don't ever remember in the right way. We don't remember in a linear fashion either. You know, it's like when you're growing up, you only, you know, remember sunshiny days when you're growing up, apparently. You know, I lived in the northwest, so I just remember quite a lot of rain. But, you know, we tend to have, like, our memories tend to be rose-tinted, so we never quite remember exactly how things happen. So to have that written proof can sometimes help us to see that we are actually improving. We're just having a couple of bad days.
Yeah, that makes sense. And I guess if you as there's no test as to whether there's an active infection, not currently a test, I guess then there's an argument that if you trust your medical practitioner and that you've gone through a period of treatment and you're seeing some improvement, perhaps you might want to consider going on a maintenance program and try some rehabilitation and just see what happens. Would that make sense?
Yeah, that would definitely make sense. And, you know, I think it's really important as well in, you know, that, you know, our body and our mind and our brain might be recovering at different rates. And if we have been concentrating on one element of recovery, sort of, you know, let's get the physical symptoms all sorted out, we might not be appreciating that our brain might need a little bit of TLC now. So I think that people really do need to take that sort of the 360 approach with it. And, you know, and so there is that definite need to sort of think you're not just a part, you are a sum of parts. You know, we are whole human beings.
No, it's a good point, and I know earlier you mentioned someone that had a stroke or a brain injury, and if somebody had a stroke or a brain injury, it would be automatic that they would be offered a rehabilitation program. Yeah. And I guess there's a question in my mind as to why that isn't normal for someone that's had an attack of a different kind, you know, an impact of a different kind. At the beginning we mentioned that you were a neuroscientist as well as a psychologist. I guess what I'd be interested to understand is what what does that mean in terms of the way you work? How is it different to a psychologist? What does that neuroscientist part of it mean? And you've also mentioned understanding the brain and the body, so it could be as simple as that. I don't know, but maybe you could explain that.
Yeah, it's that I'm really interested in how it's like chicken and egg. Does the brain affect the body? Does the body affect the brain? I'm interested in neurological differences. PhD research was around developing a wellbeing theory for autistic adults, because the neurology of autism is different to that of neurotypicals, and it was an area of work that nobody had ever looked at before, because people are quite interested in autism as in in tiny little silos. How is that different? What does that mean? Whereas I just saw a group of people who would die 10 to 15 years before neurotypicals because their well-being wasn't being looked after. And what did that mean? We have differences in the brain. How does that translate to somebody being 10 to 15 years unlucky in their lifetime span? And I've always felt a little different myself. I've always felt on the outside of things, and for me it was just sort of the natural progression to be really interested in what differences in brain meant for a human being, for individuals. And the brain is fascinating, but we already know that the more we know, the more we don't know. And it's one of the last mysteries. We still don't understand about 80% of it. Our knowledge is really basic and really juvenile in many ways, and every day there's different discoveries. And the one thing that drives me is that I just have a fundamental desire to help people to discover what their best life would look like using what they have got resource-wise within them, sort of exploiting their differences to make their life better because of it. And that has always been my burning quest in life. When I look back over my career, it's always been to help and to support and to engage with the people that most people either don't understand or don't want to understand. So I suppose it should be no surprise that is something that I can continue doing in the future. I want to work with the people that literally have nowhere else to go, because nobody else understands them, nobody else gets them, and I'm not saying that I have all the answers, but I say that I'm willing to listen and not put my opinion on you. I'm always willing to be open and accept that everybody is different. And I suppose that's a neuro part of it, that the brain is structurally quite similar, but actually it's the nuances which give everybody their individual little quirks.
And what does that mean for the way in which you work then? So if somebody listening wanted to work with you, do you work in person? Do you work online? Is it talking therapy, or do you look at, I don't know, supplements or things like that? How do you work?
Well, I work in whatever way is best for that individual. I can work on one-to-ones. I can work online. I do face-to-face. I do Skype. I've developed some online programs which people can access. I work in a 360 way because obviously I understand, particularly trauma and emotion, it's trapped in the body. I also have personal training qualifications because I understand the importance of being able to use the body to get emotions out, and to get our brain chemicals, our body chemicals, our hormones, everything working properly. I was really poorly last year, and I still stand by the fact that my red blood cells were only still working because I was continuing to do strength and conditioning training, because everything that I was being offered sort of on a medical side wasn't working. And that's the other thing that kept me going. And so that was using my body to generate more red blood cells, even when I felt like I couldn't even get myself out of bed. You know, so I now feel like I've got sort of a 360 approach. Nutrition is really useful, particularly in brain repair. So, you know, basically anybody could sort of get like a off-the-shelf approach where you get sort of a generic, you know, this will help. You know, anybody could do that. If they wanted a more bespoke individual approach, then they could get in touch with me, and like I say, I can work either face-to-face or over Skype, or create a bespoke program just for that person that they could actually do, you know, themselves, with having minimal input from me.
Thank you. At the beginning, we also mentioned research. What are you doing any research at the moment, or have you got anything planned?
I want to start doing some research into people who actually have had chronic conditions, and what their experience is, and what their experiences are, and what they feel would help. You know, because this is not just about being able to go to a doctor and that doctor have the correct response. It's about how can people feel more empowered to take control and take responsibility for their own well-being and their own pathway through illness. Because I know from my experience, when I've been in hospital, you know, as feisty and as knowledgeable as I can be, you know, about my own body, I still felt pretty disempowered. I still felt pretty helpless, and I still did a fair bit of crying because no one was listening to me, and all they were interested in was giving me opiates to take away the pain, when all I wanted was for the pain to be dealt with in the first place.
No, it's sadly seems to be a common experience. That not being listened to, I think it's very powerful. If somebody, you know, the first time somebody actually listens to you, I think is a very powerful moment. Yeah,
it's like a massive relief, because just for the first time somebody sat and said, I hear you, and I'm acknowledging that you are a person and you are going through something, and it's not in your head.
Before I go to the last question, we ask the same last question to everybody, and before I go to that, is there anything that you would have liked to have shared with us that perhaps we haven't covered, or that I haven't asked you? You know, have you any final thoughts before I go to the last question?
I think I just want to reiterate how important it is that people sort of reach out and research what would be better for them. I think it's all very well you sort of lamenting the fact that the NHS is not making us better. You know, let's just acknowledge that sometimes the NHS doesn't work in the best possible way. And there's some amazing people who, as individuals, work within the medical model. You know, I've got quite a lot of friends myself, you know, and I've actually had my life saved by having an operation in the medical model, you know, on more than one occasion. So it's acknowledging that not one system is going to be right for everybody, and to take responsibility to look at what might work for you and what might help for you, you know, and what little changes you can instigate and what choices you have can sometimes mean the difference between you still feeling like a human being and you getting yourself all confused with a condition that you've got.
No, that makes sense. I guess using the various tools we've got for their best purpose, and not expecting something to do, not expecting an outcome that isn't possible from the route you're going through, I suppose.
Yeah, I suppose that's like not having unrealistic expectations is always a mother of disappointment, and setting yourself up to fail. And if you're doing that, then you're doing yourself a disservice. And I know that it's really difficult when you're ill and you just want to sort of go to bed and go to sleep and wake up and it's all better. But unfortunately, we don't sort of live in that world where it is, you know, that is possible or that will happen. So, you know, there's so many resources out there. There's so many groups where somebody will have had something similar happen to them. Just reach out and just see what is out there, and then just sort of feel what would be better for you.
Okay, thank you. And then the final question that we ask everybody, what would you say to someone who thinks there's no way out?
There's always a way out. There is always a way. And, you know, I've worked with so many people who have believed me when I said I believe in you, and that's sometimes all that's needed. You know, I can have hope for everybody because I've been in some pretty hopeless situations personally, and I can say categorically that you might not realize it at the time, but in the future you will be glad that you have had that experience, because it's made you into a better person. It's helped you grow in some way. It's given you insight that's helped you help somebody else. There'll be something about it that at the time you like, I don't understand, why has this happened? I don't get it. I'm just so unlucky. However, but I can sort of say that I can believe and I can hope for all of us.
Gosh, when you said that you've got enough hope for everybody, I've got goosebumps down my neck and shivers. So thank you for that. That's a wonderful gift, I'd say. And thank you very much for your time today and your words of wisdom. It took us a long time to find somebody to talk to with regards to the mental wellbeing side of things, and the fact that we also got somebody that understands the brain, I think is really good, because sadly not everybody has it can accept the fact that it's not always just a psychological intervention, a psychological answer. So thank you very much for your time, and thank you very much for your insight. It's very much appreciated from everybody here at LDUK, so thank you.
No, thank you.
Goodbye then, thank you.
Bye.